Hello, this is Sherry Craig with South Central Tennessee SHIP S&P office. Thank you for joining us for 2021 Medicare updates. Thank you for Maury Regional Health's hosting of this event. If you have questions, you feel free to call us toll-free 1-877-801-0044 or locally in Mount Pleasant at 379-2927. You may email us at sctn.ship@sctdd.org. We've had many questions this year about what effects COVID-19 will have on our annual enrollment period. COVID-19 has not changed the dates for the annual enrollment period. You still only have from October the 15th to December the 7th to make your changes in your Part D coverage for January of 2021. However, COVID-19 has changed how we operate. Until further notice, we are not allowed to counsel or give presentations in person. That is why this presentation is online. Even though we can't see you in person, we are still here to help you with your Medicare questions. We are doing annual enrollment period comparisons by mail and email, and will gladly answer your questions over the phone or via email. Medicare does cover many things for COVID-19. Covers lab tests, and you should have no out-of-pocket cost. It's also covering antibody tests. All medically necessary hospitalizations are covered. This includes if you're at the hospital for another reason and find out you have COVID-19 while you're there. Even though you might have otherwise been discharged, you can remain in the hospital under quarantine. At this time, there is no vaccine for COVID-19. However, it will be covered by Medicare if one becomes available. If you have a Medicare Advantage plan, you still have access to the same benefits. Medicare is allowing Advantage plans to waive cost sharing for COVID-19 lab tests. You should check with your plan about your coverage and your cost. Please also make special note that unfortunately, scammers are using COVID-19 as a way to take advantage of people. As always, guard your Medicare card like a credit card. Check your Medicare summary notice to make sure that you had the benefits that are listed there. If someone calls asking for your Medicare number, it's all right to hang up. Medicare and Social Security will never call you to verify your Medicare number or your Social Security number. They already have those. Medicare has their own timeline or calendar. At the end of September, the 1st of October, you should have received your Medicare New Handbook in the mail. Normally in late September, Part A and Part B premiums are announced. This won't take place until December of this year. Current plan members should have received an annual notice of change from their current Part D providers already by October the 1st. On October the 15th, 2021 plan data became available to view in mymedicare.gov. Annual Notice of Change and Evidence of Coverage. The Annual Notice of Change, or ANOC for short, should have been mailed to you already. You should have received it October the 1st to give you some time to go over the changes in your current plan. You also should have received evidence of coverage or evidence that you had your plan. Some plans are able to distribute them electronically. So if you did not get one in the mail, you can check with your plan to see if you can receive it by mail or where you can find it electronically. There was a good announcement made on October the 13th. Social Security will increase by 1.3% in 2021. It's a cost of living adjustment. Beneficiaries who are receiving their Social Security will receive that with their January. Those who are on SSI will actually start receiving it December the 31st. Beneficiaries should be notified by mail in December about their new benefit amounts. Changes to Medicare costs, like your Part B premium, have not been announced yet. When they are announced, they will be posted on Medicare.gov, or you can call our office in December to find out what they are. Social Security will not be able to give you your new benefit amounts until after these changes are announced. They have to have them so that they can figure what will be taken out for your Part B premium. They will send you something in the mail in December. There has been some changes in coverage. Currently, most people with end-stage renal disease cannot join a Medicare Advantage plan. That's the way it's always been in the past. But effective January 1st of 2021, people with end-stage renal disease will be able to enroll in a Medicare Advantage plan. You should do a comparison on these plans before signing up so that you know exactly how it will cover your end-stage renal disease. Something else you may have noticed over the last year or two is your plan's management of opioid use. If you get opioids from multiple doctors or pharmacy, your plan may talk to your doctors to see if you actually need these medications and if you're taking them safely. If they decide that you're not taking them safely, they may enter you into their drug management program. You will receive a letter in the mail telling you about this. And if you believe it's a mistake, you or your doctor may appeal the decision. Safety reviews are sometimes triggered at the pharmacy. Just so you know, your pharmacist can do that, and you may need to have your doctor talk with them about what you're taking. Something else that's new and exciting for 2021 is the Part D Senior Savings Model. The purpose of this program is to provide improved access and affordability of insulin to those that need it to treat their diabetes. Some plans, some Part D insurance companies and Advantage plans will offer beneficiaries a month's supply of insulin for $35. It is important to note that not all insurance plans will be participating, and not all types of diabetic medication will be included in the program. You can, however, find out what plans are participating by using mymedicare.gov. It's this tool that the SHIP office uses to do your Part D comparisons for the next year. The Plan Finder has a filter to help identify these insurance plans that are offering this capped out-of-pocket cost. You should be able to start finding these plans yourself if you're using the Plan Finder tool starting October the 15th. There is another change we know all about already with Medicare. Part D comes with a deductible. There is a possibility that you would pay up to a certain amount. Last year, the highest amount you should be paying was $435. In 2021, the Part D deductible has gone up to the amount of $445. Not all plans have a deductible that high, but many of them do. Some other changes that have been made for 2021 are for those that have extra help from the federal government paying their Medicare cost. The amounts that you're going to pay as your copayment have increased. For generics in 2021, you'll be paying $3.90. For your brand name drugs, you'll be paying $9.20. The government will pay up to $30.21 for your Part D premium. Should you enroll in a plan that has a premium higher than that, you will pay the difference. The way we tell if you're eligible for extra help is through the federal poverty levels. Those are not released until March of each year. So until March, we will continue to use the 2020 Income and Resource Guidelines to help people find out if they're eligible for extra help. This is a chart that tries to explain the different periods of your Part D coverage. The initial period is when you're paying your deductible. Some plans may ask you to pay the entire amount before they pay anything, but many of them don't. After you get through that period, you're in the initial coverage period, which you should be paying 25% or less of the cost of your drugs. That lasts until you reach what used to be the donut hole or the coverage gap. At that time, your costs could go up to the full 25% of cost sharing, since technically we don't have a donut hole anymore. They use that to help mark the pathway. Some people get to what is called the catastrophic benefit period, when their cost sharing goes way lower. If you have any questions about that, we'll be glad to help you. You should also be able to look at the mailings that come from your Part D plans, and they will mark how close you are to each of these periods. Some people have issues with being able to afford their medications, and there are resources. There are programs by drug manufacturers that offer help on your cost. needymeds.org is the one I usually use, but many of these are good programs. You can go on there and find applications for both brand name drugs and generic drugs. Both you and your doctor will fill out part of the applications before you send them in. This is also a resource available to those that are not on Medicare that simply do not have medical or drug insurance. They are able to fill out the applications as well. So if you wanted to share that with someone else, you would be welcome to. When we talk about Part D, everyone knows it comes with premiums. However, you might not know that some people pay more than the average plan premium cost. For those individuals that made $87,000 or less, or those couples that made $174,000 and less, you pay only the plan premium. But as the chart shows, as your income goes up, there may be an additional amount added to your premium. If you ever have a question about that, we would be glad to help you figure out if that's what's going on. You have choices when it comes to Medicare coverage. Some people get their Part D coverage through a regular prescription drug plan. You kept original Medicare, your red, white, and blue card that you carry in your wallet, a supplement plan to cover the part of your health coverage that Medicare doesn't, and then a Part D plan to cover your drugs. Other people choose a completely different road in a Medicare Advantage plan. The best way I can describe that is you take all of your Medicare, you roll it up in a ball, and you hand it over there to this insurance company to manage. Annual enrollment period is October the 15th through December the 7th, and I do recommend making your changes as early as you can before December the 7th, because the system will get so busy right at the end. If you haven't already, we'll be glad to help you with your comparison. Some people say, well, why should I change? Why should I look at this every year? The answer is pretty simple. These plans are allowed to kind of reinvent themselves every year. They can change their preferred pharmacy. They can change their drug pricing. They can change the list of drugs they cover. They can also change their deductible amount. Some plans that had no deductible last year may be to the full amount this year. So you don't want to get an unpleasant surprise the first time you visit your pharmacy in January. How do I get a comparison? There's a few ways to do that. You can go on mymedicare.gov and follow the directions yourself if you're comfortable doing that. However, we're more than happy to help you. You can request a Medicare Part D prescription plan worksheet to fill out and send back to the SHIP SMP office. We'll do the comparison for you and mail it back to you. If you're here at the Maury Regional Columbia campus, you can talk to the Volunteer Service Office for instructions on how to drop off your completed form here. Here's what the form looks like, just so you know that for certain that you're filling out the right thing. The front side will ask you information like names, addresses, phone numbers, emails. We'll have to have your Medicare number and your effective dates in order to be able to do the comparison for you. Again, you may contact our office to receive one. The back side of it is where you fill in things like your medication. We need the name of your medication. If you take the generic, please list the generic instead of the brand name. Brand names will cause your comparison to be much higher. We need the milligrams that you take and the number of pills you take per day. If you take something like diabetic medication and you have a certain number of vials or pens per month, we need the pens or vials, the number of those you get per month, not how much that you take a day, but how many pens or vials that you use. The same thing with inhalers. If you get one inhaler per month, we need to know that. If it's one inhaler every 3 months, write that down so we can make the best comparison for you. You have to complete everything on both sides so that we can do the comparison. Here is what mymedicare.gov would look like when you pull it up. You have to log in to enter people's medications. So we will be making you your own login information. You will get a message from CMS once we've done this saying that someone has created an account for you. You will have a username and password. We will also send you a note listing the username and password you've been assigned. If you have a Medicare Advantage plan, you get a second chance to change that plan. If on January 1st you are enrolled in an Advantage plan, you have until March 31st to change that Advantage plan. Some people get some special enrollment periods. Those that have coverage or help funding their coverage from the federal or state government are allowed to change their coverage, their Part D or their Advantage plan, more than once a year. They may change it once per quarter for the first 3 quarters of the year. So once between January 1st and March 31st, once between April 1st and June 30th, once between July 1st and September 30th. They can also participate in the annual enrollment period. If they make a change during the last quarter of the year, their selection will not be effective until January 1st. Individuals who have been notified that they're potentially at risk under a drug management program can't use the special enrollment periods to change plans. The limitations will last until the at-risk determination expires or is terminated by the plan. If you think you've been a victim of fraud, waste, or abuse, if you've given out your Medicare number or your Social Security number over the phone, something like that, if you want to, you can call us and we can find you some help. We will put you in contact with a senior Medicare patrol. Their purpose is to help people who think that they might have been a victim of fraud. We have volunteer opportunities for you. If you're just going on Medicare or you've been retired for a while and you would like something to do, we actually cover a 13-county area. Normally, we're out at health fairs, senior centers, assisted living facilities, communities, helping people, counseling them on their Medicare. Most people can become a at one of our volunteers, with the exceptions of licensed insurance agents. We'll be glad to talk to you if you think you might be interested. Once again, here is our contact information. If you have any questions, if you need help with your comparisons for the annual enrollment period, please contact us. Thank you very much.